you really need to bear that in mind. So treating fertility patients is treating male patients as well. Fertility is a really huge issue in our Western world. It's almost every 6th couple suffering from childlessness, and the definition in the Western world is no pregnancy after 1 to 2 years of frequent unprotected intercourse. And that is really quite a good definition. In Chinese medicine, they do have 2 years of unprotected intercourse. And there's a funny story, because my daughter sees the patients coming in sometimes, and then she sat there when she was very little. She was only 7 years old, and she said, well, Mom, why does this woman keeps coming in? She's coming in for 3 months now. You should tell them that they really need to undress when having intercourse. Well, that is some kind of idea, and sometimes it sounds really stupid, but you really need to advise the couple how to do intercourse on the right timing. That is really, really important. Okay, so what are the causes of infertility now? Almost 1/3 is due to female issues, 1/3 is due to male issues. You can say 1/3 is due to both. That means that to keep it simple, it's half-half, okay? So 50% is due to male factor infertility. And even though we still only treat the women, do we? So we're missing half of the problem. We're not treating half of the problem. And why is that? Very, very simple answer: because people don't know about it. People are not aware of the fact, medical doctors are not aware of the fact, acupuncturists are not aware of the fact that 50% of infertility is due to male fertility, and we better start treating them, because we can. Yes, we can. We do that. And people have been made aware of the fact when there came out a meta-analysis, that's a good word, of 185 studies in 2017. And that made its way to the press. Yeah? So they had great response on this meta-analysis, and they looked at 42,000, almost 43,000 male participants who provided a semen sample between the years 1973 and 2011. And the chosen studies were well distributed, which is quite important, over nearly 40 years of the study period and among 50 different countries. So that is a good meta-analysis. And now it comes. What did they find out? The results were, they found out a decline in sperm concentration of 1.4% per year, with an overall drop of 52.4% during the entire study period of those 40 years for men living in industrialized Western countries. So our men, we're seeing. And meanwhile, the total sperm count among the same group plunked 1.6% per year, and almost 60% overall drop. So you can say, by comparison, the researchers, that's what I think is really, really interesting. They didn't find any significant declines in sperm counts or sperm concentration of men living in South America, Asia, and Africa. So what does that tell us? It's a Western country problem. It has to do something with lifestyle and with our environment and with nutrition, okay? And that is something we treat every day in our offices, don't we? That's what Chinese medicine is all about. We're really good in treating that. So in a nutshell, to keep it in mind and to tell your patients, which is really, really important that they know about that, sperm quality altogether, you can say, has reduced by 50% within the last 30 years. And it has reduced that much that the WHO changed the standard values of sperm tests in 2010 so that any man could achieve normal values. Okay, so they changed it, they lowered it. Okay, it's a funny thing. Whenever there's a problem, yeah, that needs to be hidden, okay, our society just changes the values. For example, if you go out and buy condoms, you cannot buy a condom size S. Nobody wants to buy that. Okay, so condom sizes start by L, which means S. Okay, it's the same, but it's just the problem is hidden. Okay, so we are very, very good in faking normality. Okay, and that's what we did by changing those standard values in the 5th edition of the standard values of the WHO. So let's have a look at that one. Okay. You see, on the left there is the 4th edition from 1999, and compared to the new edition we are used to have now, and it really did change. And I pointed out the green one because the biggest change has been in the standard values of the normal morphology of sperm. So in 1999, one man needed to have more than 14% normally shaped sperm cells. But now it is normal if he only has 4. So what does that mean? Okay, if you have a man coming in now showing you his semen analysis and he has 5%, okay? At the conclusion of the sperm test there is normal morphology. But just keep in mind in 1999, before 1999, that in 1999, before 2010, that wouldn't have been normal, okay? So to me, it isn't normal, because for my definition of a good sperm test, I also have a look always at the 1999 standard values. So I would advise you to do that too, okay? Because otherwise you don't get men into the treatment. You need to tell them that the normality is faked. So if a man comes in, has a good sperm test, is then everything fine when the sperm test is normal? No. It's just like, it's a good example. Yeah? The example is mainly for the women, but the men will also understand what I mean. As a woman, you meet this man. Okay? You meet him for the first time. And, you know, you meet him for a second time. And then it comes to the 3rd date. You know what the 3rd date means? Okay. So it's time to undress. Okay? Do we know what we're getting by looking at his face? No. Looking at his face, looking at him being dressed, is sperm test. You don't know if it looks like this or this. You don't know what you're getting, okay? Because if you undress a sperm test, you're getting to the DNA, to our genetic material, to the genetic material of the sperm cell. And you don't know what the sperm cell's DNA looks like. Is it a good one or is it a broken one, okay? And that makes a lot of difference if it's good or if it's broken. Because sometimes a normal semen analysis is really not enough to judge the quality of the sperm, as it doesn't tell us anything about the sperm's genetic material, the DNA. And therefore you need another test. And this test is called the DNA defragmentation test. There are several methods you can do that. But it's really important to test that, and unfortunately it is not commonly tested. Because interestingly, India is the leading land of the education of DNA fragmentation. It is done there all the time, but DNA defragmentation tests are hardly done in the German-speaking area, unfortunately, because they're costly and because even the reproductive endocrinologists and the RIs don't know so much about the importance it has, or didn't know, because there comes something that made the official opinion change a little, and why it is not only done when you do IVF or ICSI, because normally the procedure would have been, okay, sperm problem, okay, no problem, we can fix that, we just do ICSI, okay? Yes. Maybe the woman is getting pregnant, okay? But, now it comes. If the sperm's DNA is not good, she will have recurrent miscarriages. She will miscarriage, okay? So that is not what we want. We want the couple and the woman to have a baby to take home with. So we are never aiming for pregnancy. We always aim for a baby take home rate, a good one, okay? And that's why it's so important, and it's became even more important since a study came out at the beginning of 2019 that showed the link between the damaged DNA and the recurrent abortions and recurrent miscarriages. Okay, so that made a difference. And from that outcome of this study, it is really important and it is really appropriate to treat the man, to treat the man's DNA. Okay, so even if the sperm test is normal, you always have to treat the man because you cannot look inside, okay? And you want the couple to have a baby and to keep pregnant the full 9 months. And therefore, you need to change the sperm's DNA, okay? So, what could we do to reduce the sperm's defragmentation rate? We could use, as you see here, I borrowed this slide. You could use, from the Western perspective, antibiotics. You could use COX-2 inhibitors. You could use antihistamines. And what is really often used nowadays is you should use antioxidants. Okay? So put them on antioxidants. Prescribe them vitamin C, vitamin E, folic acid, zinc, selenium. There are quite good packages you can get. They are called Profort Fertile, for example, or Orthomol Fertile Plus. More and more are coming up. There are just, it's a package of multivitamins. They should have to pimp up their sperm, okay? So now there comes the causes of male infertility, and now it's getting really interesting. I want you to know that. There are well-known causes such as varicocele. For example, 15 to 35% of the infertile men suffer from varicocele, but interestingly, 20 to 24% of fertile men suffer from varicocele too. It is never discovered because it doesn't make any difference, it doesn't make any trouble, okay? But it troubles men when it comes to fertility issues. Then the other ones we also know, okay? So those are anatomic problems, can be solved by Western medicine perfectly. What we need to know is that a great cause of male infertility is estrogens. We do have an estrogen problem in our Western world. And there are 2 types of estrogen exposure. For example, estrogens from contraceptives, okay? For example, women take the anti-baby pill. Do you know when the baby pill has been invented? Middle of the 60s. And when did the decline of the sperm start? In the 70s. Okay. So could be some connection. Okay. Or hormone replacement. We often do that. Okay. So that comes into our drinking water, and men take estrogens via drinking groundwater. Okay, if it's not properly cleared. And then we have the problem with the so-called xenoestrogens. Xeno comes from the Latin, means foreign, okay? So those are artificially produced substances that have an estrogen-similar effect on our body cells, okay? And those are really common in our everyday life. You have them in plastic bottles, in cans, in wrapping films, in sun creams, deodorants, okay? They are free of aluminum now, but they still are full of estrogens. preserving agents in foods, pesticides, and so on. So they are everywhere, okay? They do matter. And then there is the paternal age, okay? It doesn't only make a difference if the woman is young or old, it also makes a difference how old the father-to-be is, okay? So also the male fertility is declining with age, and that actually is a common problem in men with their second, most times younger wives. Yeah? Because the volume of semen decreases by 0.03 milliliters per year, the total motility by 0.7% per year, and the progressive motility by 3.1% per year. So they're getting slower the older the father gets, okay? And what troubles the most is that it is really statistically significant that the older the future father is, the higher is the DNA defragmentation rate, okay? So you get the problem with the genetic material. So thanks to my brother-in-law for drawing me those nice cartoons. I really like them. Okay, so paternal weight does matter too. A study from 2006 indicates that the male fertility decreases by 10% every 10% of overweight. And if the BMI is more than 25, those men had 24% lower sperm concentration levels. And the raise of the BMI causes definitely a decline of testosterone levels, and that has a negative impact on the fertility. Being underweight doesn't help either, because the sperm concentration decreases according to a study done in more than 1,500 Danish men with the lower weight by 36%. Scrotal temperature, okay, very, very interesting. You have to bear in mind that spermatogenesis, okay, so how sperm is produced, works best at a scrotal temperature of 34 degrees Celsius. And that is within why our testicles are not in the man's abdomen, they are outside, because they need to be kept cooler to work properly. And therefore, you have to advise your patient, everyone to be that, should avoid the following things. And the recommendation would be from 3 months on before they want to conceive, okay? So if they want to conceive in March, stop having a sauna or a hot bath by the end of the year, okay? So saunas matter, hot baths, heat at work. It is a problem for chefs, for example, or for bakers. Wearing tight pants doesn't help very well. There has a very interesting study done in Scotland where they wanted to find out whether it has an impact if men were wearing proper tights and pants or they're wearing the Scottish skirt. And what do you think was the outcome? The Scottish skirt was best. Yeah, so let it swing, yeah, that's true. Okay, what is more a problem than Scottish skirts to our men is having the laptop on the lap. Because having the laptop on the lap rises temperature by 2.8 degrees Celsius, which is a lot, okay? You cook your eggs by having the laptop on the lap, okay? Cell phone in the pocket is very bad too. The scrotal temperature, and now listen carefully, the scrotal temperature of babies wearing plastic-lined nappies, and they have been invented when? In the 70s. Okay? Rise by more than 1 degree Celsius, okay? That is not only to nap a baby tight, it is also the plastic impact that is really, really negative, okay? So the future fertility of that baby wearing Pampers, for example, can already be negatively influenced at that age, okay? Smoking. Smoking reduces altogether the fertile phase of a man and a woman by 1 to 4 years. And sperm tests of smokers are definitely worse than those of non-smokers if the male partner smokes during an TAO cycle, having IVF. The success rate impairs, okay? And that is very interesting too. Male offspring of mothers who smoke during the pregnancy have a definite higher risk to have a cryptorchism or hypospadia, and their testes are smaller and they have a higher amount of damaged spermatozoa. And within the first 15 weeks of embryo development, smoking seriously damages the gametes, meaning the sperm's stem cells. Okay, so if a mother smokes during the first 15 weeks of pregnancy, that has a negative impact on the fertility of her son being born. Alcohol, we all know alcohol can't be good, but the good news for Austria, as being quite a drinky country, okay, is that it is the dose that makes the poison. Okay, so you need your patients to advise them to lower their alcohol consumption, but they don't have to get off alcohol completely. Okay. Drugs, of course, that is one thing we really have to be aware of. The drugs have most times reversible, but definitely negative impact on the sperm parameters. And we have to ask patients for the drugs they take in, because sometimes it is relevant to get them off them, okay, if possible, of course. So you see antibiotics, corticosteroids, anabolics, of course, anti-epileptics, antihistamines, for example, opioids, of course, all those. Everybody could say, well, I'm not taking that, but there has been a study out in 2018 saying that ibuprofen, and we all use that, has definitely a negative impact on testosterone and therefore on male fertility. Okay, so tell them they shouldn't take ibuprofen every time they have a little bit of aching. Sports is important. Men like to do sports or don't like to do sports, so what should they do? Studies say that the sperm concentration of male that practice sport regularly, but not, and that is really important, not excessively, is clearly better than from men that hardly exercise. But if you have a man who you want to have a child with, and he exercises and trains for a marathon, that is definitely not the right time to get pregnant, because sperm parameters decline, okay, when they do that much exercise. So exercising 2 hours a day, 5 days a week, leads to a decrease of testosterone levels by 40% and a reduction of total sperm count by 50%. So they should do exercise, but not too much, okay? They have to keep their energy for fathering a child and not for running a marathon. Okay, that's what they have to be aware of. Diet, an unhealthy, not regular diet has a negative impact on male fertility, but which nutrition has the most positive impact on sperm? Well, in 2017, there has been done a great meta-analysis on that topic, and then that concluded as follows. The recommendation for the positive effect when it comes to nutrition on sperm is they should stick to the so-called Mediterranean, the MED diet. You can look that up, okay? So advise the patients to get more healthy stuff, just like the Mediterraneans eat, okay? That's something which they will like. And then it is really, really important and very good researched meanwhile, male fertility has to be treated with supplements. So set them on supplements and add acupuncture to it. If you can, add Chinese or Western herbs to it. That will really help. But if you only do acupuncture, really, really set them on supplements. That would really help They have a main impact on spermatogenesis, okay? If the fabric doesn't work, if the fabric doesn't get nutrition, the outcome isn't good, okay? So you have to plant the seed in the spermatogenesis, and they need, for example, zinc and selenium and everything. Okay, so Chinese medicine, roughly. 4 main patterns. Buyu is the Chinese term, one of the Chinese terms for male infertility. And mainly, we have to deal with 4 problems. Mainly, it is kidney yin vacuity, kidney yang vacuity, damp heat in the lower burner. We have to deal with Qi stagnation, blood stasis. So those are the ones you will commonly see in your patients. Of course, unfortunately, a patient never presents with 1 pattern. Most times they do have at least 2 or 3. So there is a combination possible, of course. Just be aware of the fact. And I always, if I lecture, it's very important to me that you go home with something you can do. You can start treating men. Now you're aware that you need to treat them with a very, very easy basic protocol by Peter Dedman. I really like him. So it's those points you should use. You should use bladder 32. You should use bladder 35. It's just above the Rima ani. It's a very seldom used point, but it's really, really essential when it comes to andrology. So andrology means using bladder 35. And then you go for Ren 42. Let them go to the toilet first, because you really have to needle in deeply, insert the needle deeply, and really achieve a good Qi sensation. So with all those points, those are very few points, but you need to needle them properly and get a good Qi feeling leading into the lower burner or to the testicles. That is really important. So take your time, get a feedback from the patient whether the Qi sensation goes to, okay? Stomach 30, of course, and spleen 6. So those are your friends from now on. How should you use this basic acupuncture protocol? You have to needle at least once a week for at least 10 days. If possible, then better needle twice a week. But it's really, you get them in once a week for a period of 10 to 12 weeks. That's what they are doing. And they will love it, because they will be aware of the fact that they get really relaxed. And men, if you get them in, they love acupuncture, and acupuncture really works well in men. When treating twice a week, then the patient lies on the back on the first treatment. So you use the points on the abdomen, and then you turn him onto lying on the belly, and then you use the back points. If you get them in only once a week, I would recommend to lie them aside. So you can do everything in one session, okay? So what is really important to be aware of is the necessary treatment time. Spermatogenesis has a duration of about 86 days, okay? So you need to start the treatment before those 86 days, because sperm development takes roughly 3 months, okay? So start preparation and start acupuncture, start the supplements, start your herbs 3 months prior to the conceival. And sometimes, if fertility is, sometimes fertility treatment is something, if it works, then it's the most brilliant job you could choose, really. It's the best feeling to get a WhatsApp, an SMS, an email from a patient saying, "Thank you so much, I'm pregnant now." That's what I work for, okay? But there are so many times when they don't achieve it at this time, okay? And they don't say, "Well, my husband doesn't have good-looking sperm. Well, the egg quality is not that good. The embryo quality they achieved when doing IVF is not that good." And then I cite someone I really love for this phrase. Sometimes I look at people and think, really, that's the sperm that won. Said by someone who can say things like that, Jack Nicholson. And sometimes for the patients and for the couple, it's good to laugh about that and to think about it, okay? It's not everyone looks like a winner, okay? But at least it's the winner sperm, okay? So I really want to be in my team sperm, and if you really want to know more about fertility, we do offer from our association a 4-weekend course for everyone that has a basic knowledge about fertility, an add-on course to get an expert in integrative fertility treatment. And that course also is the perfect preparation for doing, if you want to, you don't have to, the ABOM exam, which makes you a fellow of the American Board of Oriental Reproductive Medicine. And that is a seal of approval that you are really treating on a high standard, okay? So it's done in German. Everyone that wants to do this is more than welcome. We do need people because we have a dream, don't we? Thank you. We are taking a break now, well-deserved break, and we will meet again for the German part of the plenary session.